People go into crisis every day. I've been in crisis before. We've all been in crisis before.
If you have any mental health related issue, no matter what that may be, that there are people out there who want to help you. The Crisis Stabilization Unit is a place where individuals who have a mental health crisis can come to be stabilized in a short-term residential environment. We provide, of course, mental health care to individuals who have serious mental illness. We also provide mental health services to individuals who may have adjustment disorders or just having a bad day occasionally. People can come to the Crisis Center through a number of referrals. We get referrals from law enforcement, from medical providers, from our mental health centers, but individuals can also just come to the Crisis Center. Our goal is to make mental health care accessible.
In efforts to expand community crisis services, the Department of Mental Health started funding these grants for mobile crisis starting in 2014. There are trained professionals who can provide the benefit of coming to you at the location of the crisis to resolve that crisis and also to link people to services. So the first thing you would do is you would call the mobile crisis phone number. And that phone is going to be answered by a master's level clinician who is going to just ask a couple of questions just to kind of get some background information about exactly what's going on, any precipitating events, any triggers. We do partner with our local law enforcement agency, who we have several CIT trained officers, crisis intervention team trained officers, who are trained to assist us in de-escalation in a safe manner. But then we will need an address so that we can go to the location of where the person is experiencing the crisis. One of the things that I think these teams have done for the state is it has diverted individuals from unnecessarily being placed in psychiatric institutions and unnecessarily being placed in jails, because with mobile crisis response teams, they are linked to services in the community and they can remain in their community and function. I know that sometimes it's scary to reach out for help and people are not sure who to call or when to call or where to call, but to make people more comfortable, I would definitely encourage you to call if you even have a question about someone who is in a mental health crisis or could be potentially in a mental health crisis.
There are crisis centers that are located around the state of Mississippi. The crisis centers are, for the most part of community mental health providers. So a local community mental health center has a crisis center that they refer people to. So you can really access a crisis center no matter where you are in the state.
We are available again 24 hours a day, 7 days a week. You never know when a crisis is going to happen. You cannot ever prepare to say, I'm going to have a crisis tomorrow. So we provide that support.
You see people at their worst when they come in, and to have the opportunity to get them stabilized and to have them ready to go home, usually, like I say, within the course of about a week is pretty fulfilling.